Don't you get worried about the pain in front of your hips? Or you just ignore it like people ignore you on Tinder? We get patients from everywhere, whether they are someone who can't poop in the morning because of their hip pain or someone who can't squat in the gym because of their hip pain. Some of them are very frustrated because they have tried out everything, whether it's dry needling or painful release to Instagram biomechanics tips. इंस्टाग्राम पे सबसे कॉमन टिप यही मिलेगी आपको कि हाँ, आप जब स्क्वाट करते हैं या तो लंजेस करते हैं, अपने पैरों को एक्सटर्नली रोटेट करिए और नीज को अपडट करके स्क्वाट करिए, एंड दैट विल help people up to some extent, but not more. Like every mystery movie has a twist, the rehab mystery of your hip pain lies in doing knee extensions. And you will not find this information anywhere on the internet because it is purely out of our own experience and experiment. And I invite you to try this approach if you are suffering from hip pain. When people used to come to me with hip pain, my basic approach was to just strengthen their hip muscles with exercises such as marching or weighted hip flexion or straight leg raises, and it helped some of them. But there was a time when I got a straight lifter who couldn't squat because of his hip pain. He used to feel a burning sensation in the bottom of squats every single repetition, irrespective of the weight. So it limited his capabilities to train squat in a competition depth, and hence he was frustrated. I tried basic hip strengthening, it didn't work. I thought that okay, I need to think outside the box and try out different approaches. And while trying out different things, I made him try knee extensions. And he mentioned that he was feeling a little difference in left side and right side. So I thought about trying single leg knee extensions, and I tried maxing out his single leg extensions for 10 repetitions. And there was a marked difference on the normal side and the side with hip pain. So this got me thinking, let me try following an approach for 3 to 4 weeks where I am improving his single leg extensions. So I retested his squats before and after doing this experiment, and I was surprised that there was significant reduction in pain and discomfort in bottom of the squats. Now this got me thinking, what could be the reason? Why doing knee extensions helped him with hip pain that he was feeling in front of his hips? And that's when I got to know people who are experiencing anterior hip pain. There is a possibility that they're experiencing because of rectus femoris tendinitis. Yes, there is a muscle that lies in the quadriceps region, which we call it as rectus femoris. It is a toe joint muscle that runs from the hip joint to the knee joint. Now, whenever there is a tendinitis, the simple mode of approach is to load the muscle to make the muscle stronger so that muscle is more capable to withstand the forces that it is getting. So, after 4 weeks of strengthening his rectus femoris with exercises like knee extension, the tendon and the muscle was strong enough to support the person in activities such as squats and leg presses. And I was thinking, like, okay, rectus femoris is a two joint muscle. How could this two joint muscle is being used in squatting? And I started reading literature and I came across a paper that showed that in some people there was a significant hypertrophic response of rectus femoris muscle in squatting. And that got me thinking that okay, in squatting, the bottom phase, which is usually the most difficult phase of a squat, there is some isometric phase, or there is a phase where people slow down in the bottom of squat. And during both eccentric and concentric part of bottom of the squat, there is good activation of all the quadriceps, including rectus femoris muscle. And there are many studies that shows that people who squats with an upright body showed greater hypertrophy of rectus femoris muscle as compared to those who hinge forward in the bottom of squats. So rectus femoris, if you know, it's a part of quadriceps that extends from hip joint to the knee joint. And following biomechanics, you must be knowing that if a two joint muscle is being used in an exercise, there is no tension experienced if both the joints are moving. But if any one joint is not moving, the two joint muscle is going to experience tension. So there are many examples of two joint muscle, but I will cover that topic separately. Rectus femoris is best utilized when a person is doing knee extension, because knee extension hips are not moving. The only joint that is moving is knee joint, and hence rectus femoris is being activated because one joint is not moving. This experiment I tried with three other people who came to me in a period of next 6 months, and to my surprise, all three of them got good improvement in their anterior hip pain by following this experimentation. So I want you to try this experiment out if you are having hip pain. Let's say that you are having hip pain on right side of hip in bottom of the squats or leg press or lunges. I want you to test your 5 rep maximum and 10 rep maximum of single leg extension exercise. Note down how you feel in left leg and right leg, objectively and subjectively. Objectively, you can note down if there is any difference in the 5 rep maximum and 10 rep maximum with both the legs. And subjectively, you can mention RPEs. Basically, you can just chart the difficulty that you felt in doing left side and right side for a particular weight. Then, for a 4 weeks of period, perform knee extensions twice a week with a gap of 3 or 4 days. And you can perform 2 to 3 sets of 5 to 10 repetition. And you can select a weight that is around 70-80% of difficulty. Then you can follow linear progression for a period of 4 weeks where you are either increasing reps or you are increasing weight at a micro level on a weekly or on a daily basis of the knee extension exercise. Then, after 4 weeks of following a linear progression, retest the same thing that you did before doing the experimentation. Retest the 5 rep maximum and 10 rep maximum, note down the difference. If you see there is an increase in numbers, if you see that there is an decrease in the difference between left and right knee, that means your experimentation was successful. If you see that there is an decrease in the difference between left and right leg, that means you successfully did it. And then observe how the pain is being felt on the anterior segment of your hips. And I trust my experimentation and I trust the logic behind it. You should find good reduction in the hip pain. Obviously, I'm not saying the pain will go away in 4 weeks, but you will have to try to see if there is any marked reduction in the hip pain. If there is, you'll have to continue the experiment for the time being. However, while doing this experimentation, make sure that the exercises that you have selected in the workout plan is not aggravating your hip pain by any cost. So ensure that the exercise selection is proper. If there are exercises that causes pain in hip region, you want to limit the range of motion to that part where there is no hip pain. So you can perform squats at half range of motion or you can perform lunges at half range of motion for the time being. And after 4 weeks, you can also retest your squats and lunges and see how the degree of hip pain is varying after 4 weeks of single leg extension experimentation. So, guys, that is it. Let me know how you find this information. I am all open about your questions in the comment box below. Also, let me know what you want to hear from me in the next episode. I can share you a lot of experiences. You want to hear about my experiments, you want to hear about any biomechanical analysis of an exercise, you want to hear about pain of anything or any other area of the body, or you want to hear about a specific condition, let us know below and I'll get back to you. Take care.